Good afternoon, everyone. Thank you for inviting me and giving me the opportunity to talk to all of you on this Saturday. So I'm going to talk about sleeping well with Parkinson's disease. Not the best time to talk about sleep just after a wholesome lunch. So I'm going to talk about mostly in my talk about lack of sleep, not excessive sleepiness, which can happen now since this is postprandial drowsiness. Okay, so let's get going. I hope you can see my presentation up there. So, so we'll start a little bit from history and then we'll take it forward. Now, in 1817, James Parkinson, who was a UK physician, first described the symptoms of Parkinson's and he labeled it as shaking palsy. And most of the symptoms that was described by Dr. Parkinson's were mostly motor symptoms, which means mobility troubles, shaking, walking difficulties, balance. Most of them were the symptoms that other people can see. But over time, we have learned a lot that Parkinson's is not just limited to mobility issues, but much more than that. So this is just what people see, is just the tip of iceberg. And there's so many other symptoms, including sleep, which can have a big impact on patients' quality of life and their care partners' life too. So before we start the talk, I'll give you just a little bit, and I think most of you know a lot about this, but just a brief introduction about why and what changes in the brain in people with Parkinson's disease. So in Parkinson's, it's a neurodegenerative disorder, which means the disease progresses as time passes. There's a deposition of an abnormally configured protein, a protein we usually have, but it gets misfolded and leads to deposition of an abnormal protein in our neurons. This starts many, many years before we see the symptoms. And it starts from a part of the brain called brainstem, and then slowly the protein starts involving other parts of the brain, as you can see in this figure. Now, so that's just a background about Parkinson's. Sleep is important for everybody. It's not just for Parkinson's, for all of us. When we sleep, our brain restores, not only it consolidates memory, it consolidates, it repairs muscle, it gets back your immune system back and up. It helps us ready for the next day. We sleep 1/3 of our lives. We spend 1/3 of our life sleeping. So if there's a problem with sleep, then of course there'll be effects. I'm going to focus about Parkinson's patient. It's a very common symptom. I just want to, how many people in this, even if they do not have Parkinson's, how many people have sleep troubles? Just a hand count. I have it. So I think most of us have some form of sleep troubles at some point of life. And people with Parkinson's, the number is from 60% to 90%. It not only affects your, so if you do not sleep well, it also affects your motor symptoms, which means it can make your tremors worse. It can make makes you fatigued, so your balance can go down. It can make your cognitive function, so you're thinking, you may feel foggy, you don't feel up to do things that you want to do. And then your mood, you can feel more depressed and maybe irritable because you haven't had good sleep. It also impacts what you do the next day. So if you haven't had a good night's sleep, you may not have the energy to exercise or may not have the energy to socialize, and that can have a long-term impact on the relationship that you have with your friends, with your family, and overall over your quality of life. So it also affects your driving abilities, which can be very important. So it does have multiple ramifications in a person with Parkinson's. Now, why do people with Parkinson's disease have sleep issues? So this is not a simple answer. There's no one reason. It's multifactorial. The one thing that we will talk about things we can modify, then things that we cannot modify. We'll talk about the bad thing first and get done with it. There is change happening in our brain. So our brain is changing. There is loss of neuron because of the process from the disease itself. So sleep also is a function of the brain. So that's why people can have sleep issues. But there are things which can be modified, and just picking on what is causing the problem can also make sleep better. So mobility issues, like if you have difficulty turning in the bed, then you may not have a good sleep. If you have difficulty with what we call as dystonia, which is posturing of your foot or your hand, that when you wake up in the night, that can have impact on your sleep. Difficulty turning in the bed or stiffness in the body or cramping in your leg can have difficulty. Tremors can make it difficult for you to initiate sleep, and if you wake up, to go back to sleep. So these symptoms can have impact. Mood and anxiety. It is already known that people who have trouble with primary mood issues or anxiety issues can have difficulty initiating sleep and also maintaining sleep. So they can awaken early, and treating this mood issues can have a big impact on how you sleep. It's not only the quality, it's not the number of hours, but also the quality of sleep. So you should feel rested the next morning. Um, Medications. So people who have Parkinson's are on multiple medications, and that itself can have some impact. And there some of the medications can also affect your sleep. So it's important to be aware of these effects of the medication on your sleep. Just by making some subtle changes, a timing of the medication can go a long way in having better sleep. There are people who have Parkinson's disease can also have sleep disorder. So it doesn't protect you from other disorders. So you can have other sleep disorder like sleep apnea, or where there's obstruction in the airway, which also can interrupt your sleep and can lead to troubles with maintaining sleep. Additionally, as I said, there is a change happening in the brain when people have Parkinson's disease. The internal clock of our body also changes with Parkinson's. So that also can impact sleep. Why do we need to know all these multifactorial things? Because if we do not know what's impacting the sleep, then we can't fix it. And then maybe not one factor, but multiple factors. When we fix them, we can have a big change in how we sleep and how we feel the next day. So insomnia, that's not sleeping well. The definition says if you do not sleep well for 3 days, then it is in a month, then you have troubles with insomnia. But there can be different types of insomnia. There could be difficulty initiating, there could be difficulty maintaining, and awakening earlier than desired. So most of the patients usually in Parkinson's disease do not have big troubles initiating unless they have tremors, which impact the way you initiate your sleep, and the tremors, you're shaking, so you can't sleep. Sometimes if you're anxious and things racing in your head, you have difficulty initiating sleep. But majority of the people usually have difficulty in maintaining the sleep. So they are not able to have a good stretch of sleep. So that is the commonest problem that people with Parkinson's disease face. So it's very, very important to find why you can't maintain the sleep, because figuring that out can help us fix that. We'll talk more about it in the coming slides. Usually, we do not like, I know people at a certain age have troubles with sleep. Sleeping pills are very easy to prescribe, and many people try that. But we usually avoid sleeping pills in Parkinson's disease. The commonest medication that people try for sleeping pills are the medication which end with Zepam, like diazepam, clonazepam. So these Zepams, although can help you sleep, but they do have their problems. They are very short-acting medications, so they do not last long. And most of the people with Parkinson's have trouble maintaining sleep. So even if you take that medication, it probably is not going to have a big impact on how long you're going to sleep. Secondly, these medications can make you drowsy, and if you get up in the night to go to the bathroom, you may be unsteady and may have difficulty with balance, which already is a problem with people with Parkinson's. So it's usually something that we do not like to prescribe. Additionally, they also have a habit forming. What it means, it produces physical dependence. So taking those medications, once you are on them, it's difficult to quit because the body gets dependent on this medication and needs them to maintain sleep, to initiate sleep every day. So that's something that we avoid. It's not like we never advise medications. Sometimes you have to do, but that probably should be one of the last resorts, not the first thing to do. You have a sleep trouble, take the medication. Many a times, honestly, it's also the time that you have to spend. Like if you see this physician, mostly 6 months once, you have so many issues. Sleep is usually a blind spot. People they may not spend time. It's something that you probably have to ask your MD or physician to discuss that this is a problem, because You may have very bad tremors, but maybe just fixing the sleep can help the next day become better. You may not have as many tremors the next day. Now, first options or first strategic options in patients who have sleep troubles is usually non-medical options. And I'm going to talk a lot about them in the coming slides. So sleep hygiene instructions. And I'm going to talk exactly what that means and what are the tips that you should follow. And then things which can relax you. Music therapy. Music has healing properties and the different kind of music which can help you go to sleep. Now, there are apps available which can give you those specifics. So there's white noise. You can put it on an app, set it up. It runs for 60 minutes. Then you can sleep, and then it shuts off. Some people like to hear sea sounds, like those waves are calming. You focus on them. It's almost like mindfulness. You only concentrate on the sound, and that it helps alleviate thinking about other things and can also make you relax and sleep. Sometimes there are the other tips that I'm going to share about is, so I've categorized them before sleep, during bedtime, and during day. So you have to prepare in the day to have a good night's sleep. So it's a preparation for a good night's sleep. So in the daytime or before sleep, people have troubles with bladder. With Parkinson's, bladder is a problem. So we ask people usually to avoid taking a lot of fluid, caffeine, or tea after supper or before supper. Like just stop taking fluid before supper so that you do not have to get up in the night again and again to pee, which can have a big, can impact how you sleep. There are medication. So people with Parkinson's, their bladder also becomes, it's a muscle. Bladder also has muscle. So it also becomes stiffened. That may lead to increased frequency. So there's a little bit of volume in the urine, and you feel like there's urge to go. Also, there are other things going on. As you grow older, men can have a prostate enlargement, which can press on the bladder, again makes you pee. And so these are things that, again, you can discuss with your family physician, and they can give medications to make that better. So before you go to bed, you can set up, I think most of the people do this, is nothing new, is you put an alarm that I have to go to the bathroom before I go to bed. Then darken and I'm going to talk about this later, why you should darken your room 15 to 30 minutes before you go to bed. Prepare your bed. So there are things that you can make. You should have a comfortable bed. I know many patients, they said, I bought the most comfortable bed in the world. I spent like thousands of dollars in it, but I can't still sleep. Simple tips like, you may use satin sheets, or we wear satin pajamas, which can help you roll over a little bit easier. Very simple thing. The only problem there is we don't want you to slip off the bed because, we don't want to fall because of a satin bed and say, Dr. Dash told us. So now we fell off the bed. Also, trying mindfulness. So I know saying mindfulness is very easy. Now, there are different ways to do mindfulness. One of the simple things that you can do is to do relaxation. So what you start is, you start from your feet and you slowly contract each muscle group. So you start with feet, contract your feet for a few minutes and relax them. Try going up, 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 then your calves, then your knees, then your thighs. Slowly do that and go up, up, up until your trunk. That is mindfulness because you're concentrating only on that task. It helps you not think about other things, about how this disease is going to progress, about things, how I'm going to go and get parking spot tomorrow for the appointment, things like that, which itself can help you relax and go to sleep. Avoid reading, watching TV, or using devices in the bed. So the bed should be only to sleep. There's something called bed discrepancy, where people sleep for a reasonable number of hours, but they spend a lot of time on the bed. So they think because they don't feel they slept. But if you really objectively measure it, they did sleep reasonably well. So the bed is only for sleeping, not to chat, not to see the iPad, not to do other things. It's only and only to sleep. This is almost like a cognitive behavioral therapy strategy, which again, I'm going to talk in the coming slides. So these are simple things before sleep. Now, during bedtime, again, engage in, like, some people writing down your thoughts in a journal is like you have lots of things happening. This happened, I had this trouble, I had this trouble. Not on your bed, but just sitting before you go to bed, writing all your thoughts, closing it, like a closure. I'm done with the day. Now I'm not going to think about it. It's a simple tip. but also helps you elevate the racing thoughts in your mind. Uh, okay, if you can't sleep, then don't look at your clock. So don't think about that I'm not sleeping. That increases anxiety, and that itself makes it difficult to go back to sleep. It's better to get out of the bed and sit on a couch and try to keep awake. So it's almost like opposite thing. Try to keep awake, and you will probably go back to sleep. So it's a counterintuitive thing, but does help. Yeah. Again, as I said, avoid stressful question. Oh, I have not slept. What will happen now? I'll have a bad day. So that negative thought is almost like a vicious cycle, and it does disrupt the ability to go back to sleep. Using soft lightings, and again, as I said, I'm going to tell you why. So soft lightings to go to the bathroom. So we definitely know people with Parkinson's, when you get them in the night, they may have to get up more often than other people to go to the bathroom because of the bladder troubles. And so having a little bit of a light in your way to the bathroom is a good idea to avoid falls, but it should not be a lot. Weighted blankets, some people use that, which can help you have a better night's sleep. During the day, you can nap, but do not nap for a long period. Around 30 minutes is good, and do not nap after 3 p.m. So if you want to nap, and it's very expected that, later evening, you're tired, you will not like to sleep, but before 3 p.m., your napping should be done. Exercise, again, a very good thing, but not before bedtime. So all the exercise and everything, because it stimulates neurotransmitters in your brain, which can make it difficult to go back to sleep. Okay, now this is a very important concept that I'm going to talk, and many of the things that we talked about stems from this. We all have an internal clock, and I know many of you may have heard, it's called circadian rhythm. It is run by the brain. We have a pacemaker called the suprachiasmatic nuclei, which is the pacemaker. It is controlled by multiple hormones in the brain, and there are synchronizers, we call them time givers, which run or align the internal clock. So there are actually 4 things. On the PowerPoint, you see 3 of them. One is light. Light is the most potent time giver for maintaining our internal clock. So exposure to daylight, if you go out, get exposed to daylight in the daytime, sets your internal clock well, because the internal clock is supposed to make us ready to do things in the daytime, and that's based on how much sunlight our body is getting and our brain is sensing. It goes and stimulates our retina, and that signals our brain to keep awake. That will help the internal clock go well. With Parkinson's disease, this internal clock is not running as well compared to a peer who may not have Parkinson's. So it's important to get exposed to daylight. I know it's difficult. In Canadian winter time, for 6 months, sunlight is not a lot, but there are other ways, and I'm going to talk a little bit about them in the future, artificial way of getting the same lux of daylight or bright light therapy. Feeding schedule. Feeding schedule is very important, again, because not only your brain has a clock, but all your organs have their internal clock. So feeding also helps in aligning your internal clock for your brain and your body to know time to be awake and time to sleep. So if you eat in the night, your body feels that it's time to be awake. So it's difficult to go back to sleep. So having a very regular schedule of when to eat, when to exercise, when to get exposed to sunlight, when to do things is very important, especially with people with Parkinson's disease who are struggling with sleep issues and maintaining sleep. Exercise, again, the same thing. Activity and social interaction, both in the daytime, is a time giver or a synchronizer of our internal clock. So all these things helps us have a good internal clock which knows when it's time to sleep and when it's time to be awake. If we have an irregular routine, then our brain and body gets confused about, okay, we do not know when to sleep and when to sleep. There's another hormone I think most of you in this hall would know about, melatonin. It's a natural hormone which is produced by a gland called pineal gland. So if you see the graph there, you do not have melatonin in the daytime. And if you see that blue shaded area, so your melatonin peaks in the evening. So it goes up in the evening and then goes down. So melatonin is a chemical or a hormone which prepares the body to sleep. So In people who have Parkinson's disease, they have done studies with age-matched people who do not have Parkinson's disease. Their melatonin, and this is in the second graph on the bottom, if you see the red line, it's much lower compared to their age-grouped peers. So melatonin production is not so good, and that's why also people with Parkinson's disease do not sleep well, because their internal clock is not as it should be because of the brain changes happening. So taking melatonin, sometimes I ask people to take melatonin and they said it didn't work. So it's not a medication which makes you go to sleep right away. It's not a sedative. It's not the quick fix medication, but over time it helps you to have a better, with all the other things. Okay, it's not just the melatonin, and you have to have all the things happening together for you to facilitate having a better sleep. So melatonin is of paramount importance. It's a safe drug, not very many side effects. You can go up to 12 milligrams, start with a small dose and go up. The side effect is usually, it's, as I said, it's an internal hormone. It's not something synthetic. So that can help you have a better sleep. So this is quite an important concept. Now, there are a lot of studies, and this is a new study that has been just published in Lancet 2024, which has shown that biologically directed daylight therapy, which what it means is if you sit near a bright light and the lux should be like 7,500 to 10,000 lux, and now you can get these devices on Amazon. You can see what lux they are. The lux should be more than what you have in this room. So if you measure the intensity of light here, it's much lower than what we need for our brain to get that bright light thing. And there are now devices which can give you that lux, and it's ideally should get that exposure for 30 to 60 minutes in the morning from 7 to 9 a.m. Helps us facilitate, again, the aligning of the internal clock that this is daytime, especially in Canadian winter when you do not have sunlight outside. It's an easy thing to do. Just put that light on. It not only helps you sleep better, but also helps to improve your mood. People can have seasonal affective disorder. Again, very common in our part of the world, because winter itself can make you depressed because of lack of sunlight. So a simple tool, look at the bright light from 7 to 9 a.m. You don't want to see this in the evening because then it sets up the wrong cycle. The internal clock has to be aligned, and that can help have a better night's sleep. So this is coming from really high-level evidence. It's a randomized controlled trial, which is the highest level of evidence to say that this helps with sleep. And this is not just one study. There are multiple other studies. I'm just quoting one of them, which has recently been published. Another concept. So in people who have sleep disorders in general, not Parkinson's, cognitive behavioral therapy is the first line of treatment which works the best. So what is cognitive behavioral therapy? It is just modifying dysfunctional behavior and thoughts and change it and substitute it with more positive things. And the different, I'm not a psychologist, I'm going to just tell you some concepts of what it means. So it means one is stimulus control. So what it means, you should just associate the bed, your brain should associate the bed with sleep, nothing else. Bed is not to sit and watch my iPad or phone or text. So your brain should think, if you see the bed, you go to the bed, I have to sleep. So that's almost like a stimulus control. Cognitive theory. So it's basically negative thinking pattern. So if you get up and you can't sleep, don't, oh my God, now I'm not sleeping. Now tomorrow my day is going to be really bad. In your thought, you should think, it's okay if I don't sleep for one day. I'll be okay. I can cope up. So those positive thoughts, it's almost like training your brain to cope with it. Sleep relaxation. I think I talked about the progressive muscle relaxation, where you start contracting your muscles for a few minutes, relax them, go slowly up, up, up. That's again like a relaxation technique. I've already spoke about the sleep hygiene and the sleep restriction. Again, the same thing. Try to do sleep, bedroom should be associated when we sleep. There should be no electronic things in that room. Now, there are now apps available which can do online virtual cognitive behavioral therapy. I've put on some of them on the bottom of the screen there. So they are available in both Apple and Android options, things that you can use. As I said, seeing a psychologist is quite expensive. And if you have an option of seeing a psychologist for that, perfect. But if not, there are some virtual things that you can use. Okay, so I think Dr. Fasano did talk a lot about motor problems. So one of the reasons why people can't maintain their sleep is because their medication wears off. As Parkinson progresses, the people with Parkinson's start having fluctuations in their symptoms because now your brain dopamine production is going down and you're getting more and more dependent from the outside dopamine because your brain's not producing enough. You need more from outside. That leads to when you take medication from your mouth orally, it depends on absorption from your gut, and that can have a cycle. It may be cyclical. So the medication works, then peaks, then goes down, so medication wears off. When you go to sleep in the night, you have a gap. You're not taking medication as frequently as you do in the daytime. So the medication wears off and you can start having stiffness, tremors, and other symptoms, mobility symptoms, so it's a question that you should have to ask, am I getting up because my medication is wearing off? And there are ways to manage that. You can take a long-acting medication. This is something that you discuss with your neurologist. Many times you need to also think before you have to log what's happening to figure what are the problems. And as I said, it could be multiple problems, not just one problem. So you can have the patch, which I think Dr. Fasano talked about. It's a patch which can be 24 hours. It's almost like a booster. It's not very strong like the levodopa, but can sometimes help have better sleep because it can help smoothen the night symptoms. And then there are the new more advanced therapies like the infusion pumps, which can give you 24 hours dopamine, and so you do not wear off, or deep brain stimulation, which is also like a continuous therapy, again, preventing those wearing offs, having a better motor control in the night, which leads to better overall sleep. So as I said, we have to do a little bit of an exploration of what's happening to then understand what changes has to be made. Okay, now medication themselves can have effect on sleep. Now, levodopa, as I said, all of us know, that can help with movement, but levodopa can cause some side effects. It can lead to vivid dreams. It can lead to hallucinations. So if you're in a very high dose of medication, it's a risk-benefit balance of what's bothering you more. Is more the motor symptoms? Is it more the other thing? So it's almost like a, balancing act there. There are medications like the patch, the Nupro patch, Riquip, and Mirapex. They can cause excessive, they don't cause sleep lag, but they cause sleep attacks. So they can cause excessive daytime sleepiness. So it can be an issue when you're driving on a 401 or, things like that. So it's a very small percentage of patients who have them, like 6 to 8% of patients have them, but it's again a sleep problem which can be associated with the medication. There's another group called anticholinergics. One of the common medications is Artane, not very commonly used, but you may see it on a prescription of people who have tremor. They can also cause disturbance in your sleep, can cause confusion, can cause sometimes drowsiness and vivid dreams. So again, that may be an association. It's always a good thing to review all your medication, and always, every time you see a doctor, to review, do I need it? Do I not need it? Is it worth the risk, or is there any side effects? And sometimes a combination of medication, this is more amplified. So it's a good thing to review medication if I need it. Just because it was started 10 years ago doesn't mean you may need the medication now, because now your disease is different, your age is different, your symptoms are different. Amantadine, again, a medication that's used for mostly the extra movements. So usually we avoid. The timing of medication is also important. Amantadine, if you take it later in the day, can cause insomnia. So it's better to take it more in the earlier part of the day and not the latter part of the day, especially not in the nighttime, because it can lead to insomnia. Antidepressants can lead to something I'm going to talk about. It can make restless leg worse and also can make it harder to sleep. So again, this is like, they also give you a lot of vivid dreams. So those things have to be always balanced. It's not that you don't have to take it, but again, a risk-benefit balance of is it worth the risk. So I'm going to talk about this disorder. I think most of you here in the hall would have heard of this disorder. It's called the rapid eye movement, or the REM sleep movement disorder. It's another sleep disorder which can impact your sleep. Just background knowledge, when we sleep, we have 2 phases of sleep. One called non-REM. So the REM in the full form is rapid eye movement. In one, most of our sleep is non-REM. A very small portion of our sleep is REM, where your eyes move, but your brain sends signals to the whole body to relax. So nothing other than the eye should move in your body. But as I showed you the picture again in the beginning, when people have Parkinson's disease, the protein gets deposited in the different part of the brain, so much so the sleep can get disturbed and the stone. So what happens, people start getting, they don't get relaxed in the body, and they can move their hands and they can do things in their sleep. So it's an interesting movement disorder which happens in the sleep. I'm going to run a video. I don't know how to run that. Can we run the video? Sorry. So what happens is people vocalize, they move their hands. It is much higher in Parkinson's population compared to the general population, almost 50%. The risk with this movement disorder in sleep is you can injure your bed partner, you can fall off your bed. So it's suggested that you should put railings and barriers so that you don't have them. You can avoid triggers. Some medication can do that. Alcohol and caffeine can do that. And there's some medication, and melatonin is one of the safe ones that you can use. Can you see the video? And can you have a sound, please? Okay, can you see this gentleman is sleeping, but he starts moving his body during sleep. This is not a very violent one, but people can really have violent one. They punch their. This is a very important sleep disorder now because of its implication in, again, another thing, having disease-modifying treatment of Parkinson's. Sleep apnea, again, another disorder where you have loss of, there's obstruction in the airway, and using CPAP machine or other ways, something a sleep specialist has to see you to fix. Restless leg syndrome, again, it's an unpleasant sensation in your legs. Many people who have Parkinson's have these symptoms. If the people have an uncontrollable urge to move their legs, some medication can make it worse. Sometimes low iron levels can lead to restless leg syndrome. So simple thing, testing your iron stores and fixing it can help cope with this disease. And then that can help make the symptoms better. Now, so I talked about REM sleep disorder. Sleep can be the clue to cure early Parkinson's disease. And so if you see the graph there, when people have the motor symptoms, the tremor, the mobility issues, you already lost almost 70% of your dopamine neurons. So we pick Parkinson's disease or diagnose Parkinson's disease when you've already lost the reserves from your brain. So it's very difficult to modify the disease at that point. The disease starts many, many years before that. And now, it's been some time that we now know that the disease, REM behavior disorder, or that extra movements in the body during sleep, can be a prodrome or a precursor of developing Parkinson's disease. So there's a lot of research going on now that if we give medications or treatments and do trials to see if, along with other biomarkers and other symptoms, can we slow or prevent the progression of Parkinson's to a stage where you have these symptoms. They have done studies now to prove that people who have REM behavior disorder, which is much more common in Parkinson's patients compared to general population, 50 to 80% of patients go on to develop some form of Parkinsonism. So sleep disorder can be probably, one of the sleep disorders can be a clue to modify. So if there's a cure for Parkinson's disease, this could be one. So sleep can, as I said, it's a problem, but it can also be a clue to treat Parkinson's in the future. And we're very, very hopeful for that. I'm just showing some scientific articles about how scientists all over the world are trying to target trials which in REM sleep behavior disorder, along with other symptoms, to change the course of Parkinson's disease even before, many years before you have the symptoms. So that's my slide. I am an optimist. I believe we have better future. I believe we will probably have better treatments, better treatment options, and maybe a cure, since we now understand the disease better, because understanding the disease and finding a window many years before the disease started is reason for hope. So as I said, we should all be, optimism in a realistic way. And so future probably, we all have a better future. So as I said, take-home messages, various reasons for sleep, Good sleep hygiene may be better. Avoid pills. Use of melatonin may help you have better sleep. Doing lifestyle changes, bright light therapy, cognitive behavioral therapy can help improve sleep. That's all. So multiple reasons, fix it. Thank you all for your attention, and thank you all for being here for this conference.